All right, welcome everyone to Empower Speaks Healthcare Talks. So we have a very special guest for our session today. Before I introduce her or give her an opportunity to share herself, I'm going to talk a little bit about the podcast itself. I'm going to share the story of how I actually met our guest speaker for today and then how this conversation came about. So for Empower Speaks Healthcare Talks, the idea is empowerment, right? So empowerment, whether you are a clinician, whether you're a patient, whether you're an entrepreneur in the healthcare space or you're hoping to dive into that space. Even if you're in a non-clinical position like myself, where you work with various clinicians, hospitals, organizations to implement products to help improve their processes and make them more efficient and to empower clinicians and empower patients. So that's the idea of the whole podcast at large. But today's guest is Nancy Di Nuzzo, who is by background a chartered accountant, but she's also an entrepreneur in the healthcare space. She is the founder of Anamav, a postnatal care company. I'm going to hand it over to her to share her story of how she started from being a chartered accountant and bringing her to this space. She does have a personal story as well that she's going to share, but I do want to share a little story on how I met her. So last year, we're at a networking event that was for women. And during that session, I'd shared a little bit about myself of, what my purpose was. And I'd shared with the group at large that my purpose was to leave the healthcare system a little bit better than the way I found it by the time I retire. And that was my goal. That's my purpose. And Nancy had heard that. And so she came to approach me later on because I had shared that. And her goal and her purpose is very similar. And that's how she started her company, her story. And that's how we got talking and we connected. And so that is what brought us here. So that's empowerment again, right? Women empowering one another, learning about each other's journey. So I'm so happy that she agreed and is on our podcast today. So I'm going to hand it over to you, Nancy, to share a little about your journey of where you started. How did you come about here? I know there's a personal component as well. If you could share it with the other mothers in the audience to help empower them as well. So please, Nancy, take it away.
Thanks so much, Fahreen, and thanks for having me. I'm so happy to be here today. So as Fahreen mentioned, I am a new entrepreneur in the healthcare space, and I am a chartered accountant as well. I'm a CPA. I've been working as an accountant for about 12 years now, and I continue to do so part-time in addition to my new business, Anamav Postnatal Care. This basically came about because of my, unfortunately, fairly traumatic postpartum experiences after the birth of my daughter. She was born in October 2020, the peak of the pandemic, as I'm sure we all remember as much as we would like not to. And it was an unexpected pregnancy. The shock, once it subsided, my pregnancy was pretty easy and I was obviously happy to be pregnant. But it was still a shock in the beginning because we weren't planning for it. It was pretty soon after we got married, my husband and I. But yeah, so it was perfectly normal pregnancy. I had been healthy my entire life pretty much up to that point. And even my delivery was fine and normal, what you would call normal. It was long and drawn out, but that's pretty normal for the first child. But it was what happened afterwards that really impacted me to this day. So I was unable to sleep because of the anxiety and overwhelm that I felt the first few days after having my baby. I was really set on not getting an epidural, so my birth plan didn't go according to the way I wanted it to, and I felt like it was a failure in my part for having to get the epidural. And after that point, I just couldn't shut it off. My mind, I was overthinking everything, and even though I fully trusted my husband and my mom, who was at my house helping me during that time to be with my daughter, I still wanted to know that she was cared for properly. And obviously I was also breastfeeding every couple of hours. So even though I couldn't get much more time than that to be away from her and get rest. So yeah, that continued on for about 4 or 5 days. And at that point, I hadn't slept for almost 7 days, not even 1 or 2 hours. So my brain started shutting down. I started hallucinating. I had entirely lost touch with reality, even though I didn't really know what was going on, and neither did my family members. So I ended up calling the ER, and I won't go into too much detail because it is a pretty long story if I get into the depths of it. But I ended up calling 911, and I was in the ER, and I was diagnosed with postpartum psychosis, but I was still discharged, which is a huge issue now in hindsight as I look back and reflect. But I was discharged, which was, pretty unbelievable to think of now. And so I was sent home with a prescription, and that prescription was never filled. And that partially is because of my Indian culture and background and the stigma around mental health and, all of the challenges that come with that. So I ended up back in the hospital 3 days later with high blood pressure, high heart rate. I was in hypertension and still having all of my hallucination and other symptoms related to my mental health at that time. And so at this point, I was admitted to the hospital and I stayed in the psychiatric ward for 6 nights, which was definitely the most challenging and traumatic 6 nights of my life. And during the time at the hospital, I knew I had to do something about this to prevent other women and other parents from going through this experience. But obviously I had to recover myself first. So it was a pretty long recovery process. I was on medication, I did therapy, I needed my support of my family to get through it. I had a lot of emotions during that time, was guilty and angry and sad and confused and trying to understand my diagnosis and what happened and why did this happen and all of these questions, right, that I didn't really get answers to, honestly, even to this day, to some of those questions. But thankfully I was able to fully recover, and I even went on to have another child, only because I'm an only child. Otherwise, there's no way I would have gone for another one after everything I went through. But thankfully, I had my son, I was going to say last year, but we're in Jan right now. So 2023, I had him. And thankfully this time I had a much better experience, but it's because I lined up much more support at home and I stayed at the hospital an extra 5 nights preventatively. And thankfully, nothing happened the second time around and no need for medication and all of that. But it was quite a rough couple of years and a process and experience, and going through my recovery, even managing my anxiety when I was pregnant with my second, about everything happening again, that was a journey in itself. But yeah, so I went through that. And then in my mat leave with my second is when I started thinking about, okay, now this is the time that I feel like I've had a positive experience. I've had enough distance from my negative experience, and I'm now ready to support others. So because of that, I took the time to think about what I wanted to do. And the catalyst was really going to a conference in November of 2023, which was for women, more specifically mom entrepreneurs. And I went there not having any clue of what I wanted to do, purely looking for inspiration. And I found it, and I spent the entire day basically telling people I wanted to open a postnatal care center. So after going home and thinking about it further, I took the leap, and in January of last year, a year ago now, I incorporated my business and started working with a healthcare consulting firm to do market research, cost analysis, and lay out the plan for this postnatal care center and what my vision really was. So I spent a few months on that. And then I talked to a bunch of different people, including in public health. And I realized that this is going to be a several years out project. And I don't really just want to do my accounting job during that time. I want to start supporting people now. So because of that, I shifted to in-home services. And so we launched our postnatal care agency officially I made everything public in April, but we started offering services in August. And I pretty much spent the time up to that point building up our team and figuring out the details of the services that we offer and all of those things. So yeah, that's pretty much it. I'm happy to share more about Anamav down the road as we continue our conversations, but that's just a bit about my background and my story.
Yeah, no, absolutely. No, thank you, Nancy, for sharing that. I know to be vulnerable and sharing that, it can be hard. So I appreciate you doing that with me and the audience. And there's a lot to unpack there. So I appreciate you sharing that story, because even when I met with you the first time and you shared postpartum psychosis, you hear about those terms, but when I actually had to Google it, what that actually meant, right? And there are probably so many other mothers or other family members that have someone that may have gone through something similar and didn't know what it was or how to help them. And so I appreciate you sharing that. So even if somebody else, even one person in the audience hears that and it's like, oh, that's what it is. And be able to kind of seek out the help that they need. So I think it's beautiful, that journey, how through your personal journey, your story, you've brought, opened up this space and already, tackling it. Even like you said, to have a center, it's going to take a couple of years, but why not start now? So I think that's beautiful. So just to kind of dive a bit deeper for those that are in that space, what kind of so you do offer home services now. What kind of services do you offer so that somebody who is seeking that out or the new moms on their way and experience that they know, okay, this is what I can seek out for to help myself and my baby and my family. So yeah, if you could dive a bit into that.
For sure. So we currently offer postpartum doula services. And for those of you that don't know what a doula is, they are like a support person that are specifically trained to take care of a new mother and new infant. They go into your home, into our clients' homes, and they support them with pretty much anything that they need, including all areas of infant care, emotional support for the mother, providing education and resources for how to take care of your baby and yourself, even within the family unit, taking care of everyone, tidying up around the house, really whatever is needed to provide peace of mind, comfort, and support during that time. So that's one of our core services. Another service that we provide is lactation support services for those of parents that are able to and choose to breastfeed. So they're provided by IBCLCs, which is like a certification specifically in the area of lactation. And so again, that's also an in-home service after baby is born. But we provide prenatal consults too to answer any questions and basically support with any challenges that second time or third time parents may have had in the past to prepare for their birth and their postpartum breastfeeding experience. And then we also provide psychotherapy, which is a new service that we've launched. It just made sense and fit with everything, like my own journey and what I'm hoping to achieve with Anamav in terms of protecting new parents' mental health. So we provide psychotherapy services during the perinatal period, whether it's pregnancy or postpartum, for moms or dads or any other caregivers of parents. And then we are going to be launching sleep consulting services very soon as well to help moms and babies and families sleep better at night. Because I think, to me personally, the reason why I chose these services is I feel like they're all interconnected and, they all tie into mental health, which is obviously the area that I'm passionate about. And I feel very strongly towards protecting that for new parents. And I just want to clarify, I know my experience was with postpartum psychosis, but I don't know, you probably didn't even know this, but I actually just completed a perinatal mental health certification in Canada. So I'm pretty well versed now in the various different perinatal mood and anxiety disorders that can occur. So I just want to say postpartum psychosis is considered rare and extreme and is a medical emergency, but there are several other PMADs, they're called, right? Including perinatal anxiety, depression, OCD, PTSD. There's several different disorders that can occur during pregnancy or postpartum. So it's just, I think it's really important, especially first-time parents, to be aware of these things so they know what symptoms to watch for. And that's part of the work that I do as well.
Yeah, no, and I appreciate you kind of diving into that. Like you said, psychosis is a more rare case, but like you said, other moms that are, like you said, depression, PTSD, you name it, there are other pieces that fall under the mental health umbrella. And I love that you mentioned how, in addition to all those services that, lactation services and all of that you offer, that you kind of honed in on psychotherapy. Because currently my background right now, I'm on the vendor side. So I work for a company that provides, a portal, patient portal and telehealth services for the behavioral health space, so the mental health space. And I truly can understand the importance of that. And like you said, kind of overcoming that stigma. It is so important. And I really appreciate you sharing this. So that way there's awareness, right? It starts with conversations. And so through that, they can even go on your website and be like, okay, these are the services. And just kind of building off of that. So the services that you offer, are they through insurance? Is it out of pocket? If someone wanted to, if they heard this or were just kind of trying to understand, how can I access those services for myself, my loved one, a friend? How does that work for them to gain those accesses on a more monetary side?
So some of them are covered, as you know, I'm sure, like all the registered healthcare providers, like psychotherapists, social workers, a lot of them are easily covered by insurance plans. But unfortunately, some of the other services that are newer or not as widely available, such as the doula support and the lactation support by IBCLCs, are not always covered by insurance plans. But thankfully, they are starting to be covered for certified individuals. So there are some insurance companies that cover them now under the extended health benefit plans. And this is actually an area that I am also looking into learning more about and expanding. I have had conversations already with a few different insurance companies to learn more about the process of how these types of services even get covered in the first place. A lot of it is dependent on, what the government deems to be covered for the medical tax credits and other things like that. So it seems like the insurance companies tend to follow what the government considers covered. But yeah, this is definitely an area that I'm interested myself in learning more about, because I think all of these services should be covered and affordable by everyone, right? That's really the long-term goal. And why is it not covered under OHIP? You know what I mean? So yeah, I know we're far from that point, but it is definitely essential service in my mind.
Yeah, no, absolutely. And I think that's so important. And the reason I raised it so we could have awareness on the podcast is because even for ourselves, like even personally, right, I'll look at my insurance plan and see what is covered. And sometimes it's not the best way to go about it, but sometimes you'll look like, okay, what is covered? And it's human nature. You may cut corners, even though it's our health and it is so important. We will go through, okay, what is covered by OHIP, like you mentioned? What is covered in my insurance? What is going to be out of pocket? And even though we shouldn't, we should always do that cost benefit analysis, but sometimes we are constrained financially, right? There's so many factors to that. So I completely agree of the importance of it. And that's why I kind of asked so that those that are looking be like, okay, is it covered in my insurance? They know, okay, registered services, like you said, registered professionals, whether it be a psychotherapist or what have you, that they can see, okay, this may be covered. And so they can get the help they need because as much as, like you said, and I completely agree with it, that they're all essential services. And if you are an individual, a patient in need, that you should be able to access that. But there are those barriers, and financial is one of the biggest ones. So I think it's really important. And like you said, accessibility, right? The services, if they're there, if I as a patient cannot access them, then what good are they? So I appreciate you kind of sharing that and kind of dabbling into how you want to dive into that a bit more deeper to make it more accessible and how those conversations, whether it be through insurance companies and what have you. So I think that's incredible. I'm going to take a step back, and the next question I have is more to dive into your entrepreneurial journey. So right now, I know we dived into, patient empowerment, your journey as a patient, what that brought you here, even those others that may be patients or loved ones of a patient that want to seek out those services. So taking a step back in focusing and honing in on your entrepreneurial journey, if you could kind of share how you kind of got yourself into this space. And what do I mean by that is you have a chartered, accountant background. So you have that business, that mindset. But being someone that's not in the healthcare space, a lot of people I talk to, they're like, I want to enter the healthcare space because I want to be fulfilled. I want to, leave an impact and, pay it forward despite what my, background is. And so if you could dive a bit of those transferable skills, because there's so many people that may want to enter the healthcare space, but like, no, I'm in marketing, I'm in finance. How do I do that? How do I make that leap? So if you could dive a little bit into that and kind of building off of that, how you navigated that. I know you consulted with an agency to help you, how you kind of navigated those challenges, those barriers. If you could share that with the audience.
For sure. So a few different things here. I mean, one is entrepreneurship has always been something that's been in the back of my mind for several years. Like I was always interested in it and like, curious about it, but never really brave enough to take the leap or didn't even think that I had a good enough business idea or plan to do something different. And accounting was always like the safe bet, right? And it was just so easy to just keep getting promoted in my firm and like staying with my peers that I went to school with, right? And all of those things. But obviously this experience was enough to push me to do something different and change my entire career path, which like, I'm not going to sugarcoat it. It's terrifying, right? For anyone that has gone through a career change, like at this stage, right? It's definitely scary. But I'm passionate enough about what I'm working towards and, the support that I want to provide that overcomes the fear. So that's in terms of like how I feel. And now that I am an entrepreneur, like it's definitely also very exciting and fulfilling and rewarding and, all the things. So it's fun. First and foremost, like separate from everything that it actually relates to, entrepreneurship in general is pretty rewarding experience. But specifically in terms of healthcare and like how I felt about it, yes, I worked with the healthcare consulting firm and I will continue to do so as I do more, especially before I were to ever consider opening up a physical space. Like that's an entire endeavor. It's a huge commitment and project and all of that. But this space, particularly the in-home services, I mean, I had used personally myself, I had used doulas at my home, right? And I had used IBCLCs personally. So I was comfortable and familiar enough and had like enough of a network to feel confident to start offering these services. And the other big thing is that I'm, relying on a team that is experienced much more than myself. So I'm new to entrepreneurship. Maybe I'm also a doula that's certifying myself, right? But I only have done it mainly for the background and the education and experience, and not so much to support clients in person because it would be hard to do that and also manage everything else. But I'm relying on this team of experienced professionals that have their own credentials, experience, and background, right? So that is what makes it so easy for me to do all of this work, is that I'm able to lean on them for their expertise, knowledge, and everything that they bring. And that was part of my interview process and my intake process with them, right? The recruiting aspects of it. And so, like, for example, one of my IBCLCs works full-time at Mount Sinai for like 30 years. and has gotten nursing. She's a registered nurse. So you know what I mean? Like I have no issue providing services if I have people like that on our team. And there's various other different practitioners and, service providers on our team. So that's why I don't feel like I'm new to the healthcare space, because they're the ones that are actually providing our services. But aside from that, I mean, in terms of transferable skills, whether you're in business or you're in healthcare, you're working with people, right? Like that is a universal skill. You have to be able to communicate. You have to be, be intuitive. You have to be compassionate. Like all of these things you need to be regardless of your career to make a meaningful impact on people. So I think there's a lot, even like problem solving, analytical skills, like all these things are very relevant regardless of like what career I'm in. So no, I definitely think there's a lot that helps.
Yeah, no, I completely agree. Like whenever I have these conversations with individuals and they're like, like the transferable skills, and I think you're so right. Like it's those soft skills, like you said, the ability to work with someone, the ability to problem solve, all that carries on. And it's just a different industry, right? Regardless of where you're at, you just navigate that, you learn, you ask those questions. And I love the part in the beginning when you answer that question where you mentioned where you always knew at the back of your mind that you wanted to be an entrepreneur. It's just that voice conforming to society that this is my expectation. Being a chartered accountant is a safe bet. Just go down that route. We've seen in the past, it's, you're able to, achieve success. And even for myself, I'll even share that about the podcast. I love public speaking. I think I even told you this when we first met. And I was like, in my head, I was like, I need to use that skill. And it's been years since I've been thinking of this podcast. And I was like, you know what, like you said, I'm like, this year, just going to do it. Like sometimes you have to take that leap of faith. And if you have those thoughts, I do believe it's, whatever you believe in, that, the universe or what have you is trying to speak to you that this is your calling. Just dive into it. What happens will happen. And so I completely agree with that. Definitely resonates with myself. And I think the piece where you mentioned how you have, such a wide group, your staff is a variety of individuals. You have a team member who has 30 years of experience and she's also able to offer services to your patient base, your clientele. So that being said, when you first started, new into the space, and it's like you said, you only started last year, January. It's been about a year. So how did you grow yourself? Because, for those listening, if you check out her website, she has a large team that is in the various services. Each one of them has multiple individuals. And so just wanted to ask you, when you first started, how did you be able to recruit these individuals? So I guess twofold. So first, recruiting team members on your team, various registered professionals, so you could build the organization, your team, so you could offer these variety of services. And then the second side, on the opposite side, how did you cater to build a patient base, right? Because it is a new venture. It is not as known, like you said. So if you could share both sides of it, how did you navigate that from day one? So those that are looking for or trying to kind of understand, what's the first step that I need to take? If you could share that on both sides of that.
For sure. So starting with the team, the first point to find individuals to join our team was my own personal network, right? Like that is probably a given regardless of whatever endeavor you're going on. But so fun fact, 2 of the doulas are my doulas that I had when my son was born. And same with that nurse that has 30 years of experience. She was my nurse at Mount Sinai. So that was, she was my IBCLC supporting me with my breastfeeding journey. So it was definitely, and, them knowing me personally and like my family, and then knowing like the struggle that I had with my daughter and everything that I went through, they were passionate enough to believe in my story, right? And like believe in what I was doing. And they supported me enough to join the team, which I'm very thankful for. So that was the initial couple of people that were interested in joining me. And then of course, like I just marketed publicly, posted the jobs and did like the recruitment process that way. I met a few new people. Some of them, when I interviewed, they gave me references. So for example, I interviewed a doula who gave me a reference of a lactation consultant, called her as like a reference check. She said, "Hey, I saw you're also looking for lactation consultants." And that became an interview. Like, you know what I mean? Like it was mostly through like my network and posting on LinkedIn, Instagram, like using the social media to your advantage and not just the negative aspects of it. But, it was really, I feel honestly pretty fortunate for having found this many people that believe in what we're creating and that support our vision and want to do this work and are, equally as passionate about postpartum and about mental health and all these things. So it wasn't too difficult, which I'm very thankful for. I don't know if I just got lucky. Honestly, I don't know. But I'm very, very happy with the way things went. Yeah, so that's on the team side. And then in terms of clients, I mean, that is a struggle really for any new business, right? Still a work in progress, trying to figure things out as I go, and just trying to market as best as I can, whether that's through Facebook, again, through like word of mouth and referrals and networks, right? So that's currently something I'm working on, like my outreach to various different clinics and just sharing more about my story and what we're trying to build, right? And all of these things. So it's still ongoing process, but we have served clients, and we do obviously appreciate those first couple of clients that we have supported. And yeah, we're thankful for their trust and continue to work towards getting more clients and more awareness of our business.
Yeah, no, absolutely. And I completely agree with you when you said that you kind of just tapped into your network. Even the conversation we're having right now, it's kind of tapped into my network.
Exactly.
And I think, like you said, sometimes it's just asking. If the answer is no, okay. But sometimes it can be a yes. And most of the time, at least in my experience, and I see you nodding, so I think for you too, sometimes you ask, there are people who want to help and that want to kind of share their experience as well. So I think that is so key. And then the piece about like building your patient base or your client base. And like you said, you're still, growth strategies, trying to figure out using various, social media platforms or what have you. But I do believe word of mouth is very key. Whether in my own work experience right now, word of mouth is how, when people hear about it, they share it with somebody else, one organization shares with another, or a patient themselves, right? So I think that's also the beauty of this podcast. Or if someone listening to this may not be going through it themselves, but they know a loved one, they can, steer them your way to your website to access that care. So sometimes I think we forget how important just basic word of mouth is. Having these conversations, having that awareness, in addition to everything else, is critical too. But those that are listening and wondering, I do think word of mouth, and like you said, just tapping into your network. You start small and then you kind of make your way from there. And so just kind of building on that piece. Like I mentioned, my background is in digital health, and there's a lot of conversation about that. Now in your space, so I'll kind of just give a bit of context to that question, and then I'll open it up for you to kind of navigate. But, we'll talk about electronic health records where you can document the patient's information. Is that something that you use? Or something as simple as a website to book services? Sometimes we put a lot of weight on technology. And like I said, I do think there's a time and place for it to empower. But sometimes it can be something as simple of streamlining a process, a workflow, so that it allows for more efficient care. So in your perspective, in the space that you are in, are there certain technological or digital health tools that you use to empower your clinicians or your patients in any aspect, or maybe not? Or in the future, are you planning on kind of bringing that in any scope, essentially? Any thoughts on that?
Yeah. So this was actually a pretty early decision that I made to invest in a platform that is compliant to even be in hospitals in Ontario. So we do have a platform that we use. It's called Grow with Treehouse, and it is specialized in maternal health and is all about integrated care. It is definitely, I wanted to, and it's female founded. So I wanted to support this organization, which is why I honestly, part of the reason why I went with them, but it is also a great platform to use for us for client document management, documentation, as you mentioned. So we do document everything just the same way as like other healthcare providers, even though this is not, necessarily all regulated healthcare in terms of doula services, and all of that. But yeah, and even for teleconferencing, like it is secured and all these things. So all of these considerations I did have when I was choosing this platform. And I don't think that, all agencies in this area do that and necessarily use these types of platforms, but it was a consideration for me long term, especially as we grow and evolve. And, if I want to have a physical location, it becomes even more important to have that secure and confidential platform and documentation. So yeah, it is. I do totally agree that the digital aspect of healthcare and processes and all of that is so key. Just for even operationally, I feel like tech is so important. And I'm realizing this now as I, have to do things manually. And I'm like, why is this not automated? Why is this not happening? Like I realize it, right? Like the little things totally get to you. And yeah, I think it's huge and like definitely the way to go for the future in terms of everything being automated.
Yeah,
Yeah.
no, I appreciate it. I'm so glad that, that you did take that into consideration. And like you said, being compliant. So PHIPAA and HIPAA compliant is a key factor, like you're saying, because me right now as a telehealth and patient portal, that's a key aspect of it, right? For patients to be comfortable using it. They may not necessarily know, but for organizations to take that on, that is the question number one. Are you compliant? Otherwise, that's a whole nother loophole that you do not want to get yourself in, right? So I think that is so critical. And like you said, having a platform for that. So documentation on your perspective, right? So whether, if one, specialist, one registered clinician is, providing care services to a patient, and let's say they're away the next day or what have you, somebody else can just go in and see that. Data is so important to provide that care. Otherwise, they're going to go through it again and ask the patient again the same questions. Okay, where did we leave off? What was your treatment plan? Whatever it may be. And I think that is so critical. Just a follow-up question to that. So essentially, for your team, it's kind of like an electronic health record where you keep all your patient documentation. So amongst yourselves, you have your patient profile and you can see what services they're seeing, what the plan is, their care plan, what have you. So on the patient side, is it also a patient portal where they can access their data? Okay, I see you nodding.
Exactly.
That is so critical. Yeah.
And then for us, like, just to give you a more specific example, like, we sometimes have 3 doulas servicing the same supporting the same family, right? So then if one doula has a shift, like, they can go in and look at this platform and look at the documentation from the previous doula shift. So it's super helpful in that sense, just so they can catch up and see whatever background information they need. And with postnatal care specifically, things can change drastically day to day, right? Like, in terms of mood, in terms of like the newborn's health, in terms of their behaviors and like what the mother's needs are, right? Like, all these things can change day to day. So I think that's like pretty critical for the reason why I wanted to do this and invest in the platform.
Yeah, absolutely. And I think just building off of that piece earlier when you were explaining the platform that you use, you're saying how it's like, able to integrate, like you said, the various hospitals. And I think that piece is so key. Like right now in my role, when it comes to us like integrating with electronic health records, it is so key to have that integrated. So there's data in the electronic health record for it to feed into the patient portal and what have you, right? So that is so important. And even that patient portal, it travels with the patient. So right now we have a feature where it's called View Client Data. So it's their medications, their lab results, all of that. So it moves with them. So if I'm your patient, I present in the ER, at least I have that is moving with me. So you can see, okay, actually she is on X, Y, and Z. Will this, kind of react with this or, and so it's so important. And so the reason I'm kind of honing in on this is to kind of help the audience and everyone understand why it is so important. I love the fact where you said that it is integrated. And so do you mind just dabbling a bit more when you say it's integrated with hospitals, like they have open APIs that it's able to integrate, or what do you
I definitely
mean
can't speak to the tech aspect. You'll have to have a separate call with their team to have more details on it. I just mean like they are like able to support hospitals in terms of being compliant with all the required regulations and all of that. I just know that about because I've talked to the CEO myself personally. But in terms of us, like, there is a community portal on this platform where you can message other service providers. So even if you share a client or a patient, you can, have conversations with them and stay in touch that way. And like the patient or client can authorize, those conversations and sharing of information. So it's integrated in that sense. Yeah. And I don't, claim to know this at all about our healthcare system in general, but I'm sure that this transfer of electronic records and that information is not happening across the public health in general. So I'm sure we're far from that, but it would be lovely if we could get to that point.
Yeah, no, I agree. Yeah, so you could tell my brain went there because like being in the digital health space, we know how important that interoperability is. So yeah, no, I appreciate and I think it's important having these transparent conversations that we're still a ways away, but whatever steps we can take, like you said, it is compliant. Your patients are able to interact with other clinicians that they may be seeking services from. So I think there's still pieces. Like I think we always have to look at it from a perspective where we may not be where the ideal state is, like you said, to be fully integrated and all of that. And we're aware of that. But I think it's important to at least acknowledge the small wins we do have, that we're able to do X, Y, and Z. And then that can just keep us propelling forward. So I think that is so key. And you could tell that I was like, okay, let's hone down into this because this is my space where I was like, all right, let's talk about this. So I appreciate you having that transparency. And sharing what you do know and what you don't. And I think that's so key as well. So yeah, so moving forward from that, from your perspective, like in this journey that you've had, what are some of the challenges that you've experienced? What are some of the lessons learned? What are some things, I know these are multiple questions, you can choose how you want to answer it. What is something that maybe you would have done differently? So if you could just share more on a personal level on those aspects, or more, larger scale at the organization at large, or granular on a more personal level, however you want to take us in this response or journey of yours.
Challenge, I'd say the biggest challenge, two big challenges pop out in my head at that question. The first is the guilt aspect of being a mom and a business owner or working parent in general. No matter what I do, I will always be guilty of something. So that is something I have personally experienced and worked on and like tried to get past. Obviously, I'm not doing it perfectly, but definitely over the past year, as I worked on my business, there was several moments of me feeling guilty that I'm spending so much more time on my business than with my kids. So, and they're very young, right? Like they're 4 and 1. So it's really hard to be away from them and feel good about it. So, that's definitely a challenge that I've faced of starting my entrepreneurial journey at this stage in life with my kids being this young. But then I talked to other entrepreneurs whose kids are older. Like I remember having a conversation with another mom entrepreneur whose kids were, I think, like 7 and 9 or maybe 11. And she said, her kids are old enough to complain about her being away so often. So, maybe she thinks that I'm better off because my son can like not fully talk yet, So, the goal is that in a few years, my business is more established where I have more flexibility in my time, right? Like, obviously, that's a personal goal of mine. So I try not to be too guilty, and, tell myself that in the long run, I want to have more time with them and flexibility. And I want them to be proud of what I did and like, the brave steps that I took of starting a new business, of changing careers, of following my passion and supporting families and making an impact, right? So I try to have these conversations with myself when I do feel guilty, but guilt is definitely one of the big challenges. And then the second one I'd say is around uncertainty. I've never been good with it in any aspect of life, like knowing what's going to happen and wanting to control things and wanting to plan things, right? That's just my pure type A personality, which has had to change after becoming a parent and going through, a mental health crisis and all of that. But still, the uncertainty around being a parent and not knowing what's going to happen. And then now the uncertainty around having a new business and being an entrepreneur and not knowing what's going to happen with certainty, right? Like it's definitely, I'd say, one of my biggest challenges. Was there another part to your question? Now I don't know. What else is there?
Yeah, no, I'll follow up with that. I'm just going to add a tidbit to what you just shared, and then I'll kind of repeat those questions. So no worries there. I love the piece where you said that, like the grass always seems greener on the other side, right? Like you're saying that, as a mom with young ones, you're feeling like, you're missing out on pieces. And then other mom entrepreneurs are thinking, okay, my children are older, so you can never win. But I do think like even the girls at work that are mama bears like yourself, something that I always have this conversation where you have to fill your own cup before you can kind of fill others, or like that analogy where you're on a plane or airplane, you have to put your own oxygen mask first. So I think by pouring into yourself, and I think women are guilty, like you said, that's where the guilt comes from. And it's part of society and being women that we feel guilty when we kind of pour a bit more into our own cup. And so I think it's important to have that self-reflection so that you're aware, like, okay, am I, also at being a mom, being an entrepreneur, making sure that I am trying to provide what I need to. But I think it's important that as women to pour into your own cup first. And so by doing that, when you are with your children, you are more present. You are being the best you can be because you are full. So I think that is so important. And I think also being vulnerable, being like, I have a guilty conscience of this, but I'm still going to do it, move ahead, be the best I can as an entrepreneur, as a mom. I'm going to make mistakes. I'm going to learn and keep moving forward. So I think that's so key. And I'm glad you shared that because like I said, I have these conversations with the girls that are moms as well. And I think it's important that we have these conversations and share that we feel like that and it's okay. And to keep making those decisions and use your discretion. Like you said, there may be times where you have to be, step more into being a mom than being an entrepreneur. So I think that's key. The next question that I had, just kind of building off of that. So I know you addressed some of the challenges that you had. What are some lessons learned or something that you would have done differently, or maybe not. You're like, you know what? Every lesson was good. You like you said, like when you said type A, I'm like, yo, hand up, I'm type A too, and you kind
I
of
read
learn
a
with
lot of
life.
them. I
That
attract them.
right. So like you
For
said,
sure.
uncertainty, going with the flow. But I know you said you have a whole list of them, but if you could do maybe the top 1 or 2 lessons learned or anything that you'd have done differently that you think is quite something that you'd want to share with somebody else, or whatever you're most comfortable with. So I'll hand it over to you.
I don't know. I mean, I don't know if there's necessarily anything I would have done differently in my business, because I feel like entrepreneurship, like there is no right answer. And, I'm just, as I'm sure a lot of people do, like figuring it out as I go along, because I do think like if I followed my planning nature and like spent all my time and energy planning it out and making it perfect, there's no way that I would have even started, right? Or progressed. So I don't think like that's something I would have done differently. Honestly, I don't have anything particular in mind that I would have done differently, been less guilty. I don't know.
I think no, that's
um,
valid
there's
too,
no,
right? So
yeah, and maybe like with my time, that's probably an area that I definitely want to work on, or I have found challenging, or, I feel like I still haven't perfected my own time management and like, prioritizing things, um, learning how to time block and be like hyper focused and efficient. I don't know if there's like some secret that someone has that can share with me. I've been trying to figure it out, how to like get more out of the 24 hours that we have. I don't know what I could have done differently, but that may be an area, like more efficiency with my time.
no, and that's valid, right? I think just having a very organic conversation and vulnerable piece about, like you said, like I don't think I would change anything, and I think that's so important. I love that you said that. I was like banking on you saying that, and I'll share why. And the reason I say this is sometimes in life we always say like, I wish I'd done this or I should have done this. And sometimes it's also being okay with just being present. You are where you need to be, whatever you went through, whether, as an entrepreneur, as a mom, all those pieces brought you to where you are, right? So I think that's a beautiful piece too. I think sometimes it's being cognizant of that as well,
I
right?
just remember something that I maybe wouldn't have done. It was many years ago though. I've done one too many designations and certifications in tax as an accountant, which maybe I didn't need to do if I was going to end up here and entrepreneur in the
But you
postnatal
for
care.
the finance thing, you got that down. You
So
don't need to hire nobody. Like,
maybe I didn't need to do a master's of taxation. Like, don't let my just hear this. But in hindsight, yeah, maybe I did one too many designations and certifications in accounting.
no, I think it can go
How would I
both
have
ways.
known back then, right?
Yeah, no, and I think that's fair too, right? Like I think at that point you were in a different, like I think hindsight is always 2020, right? Where you're like, okay, maybe I didn't need to do this. But I think that also may give you, like I said, like I know I was laughing as I said this, but like from the accounting side, you're good. You don't need to like you're covered on that. So I think there's that piece to it as well. And there must have been pieces that you must have learned through the masters and all of that brought you to where you are today. So I think, like you said, I think we can always reflect. But I think when you initially said that, it's part of the journey. It's learning as you go. I think that's beautiful as well. And I think sharing that as well, like some audience members maybe thinking, okay, I should go for further education, and not to date ourselves, but like, in our time, like back in the day, like it was like you do X, Y, and Z. And like you said, it was very traditional paths. Things have changed.
First of all, I'm definitely older than you. We're not going to talk about how old, but
Trying to figure out ages now.
we're both younger. We're both a little younger than we are.
I'm good with that. But I think it's important to have those conversations. Like you said, when we, going through our academic journey, we're happy. It was like, okay, you have to do X, Y, and Z. And now things have changed. And I think having these conversations and owning it and sharing that with others, I think is important too, because someone may be in a position that we were a couple of years back or, and so they can reflect on that as well. So I think that's fair to share that. And I think, but whatever step you take, it does help you. I think the time management piece, I think we're all trying to work on that piece. And I think it's just trying to be, when you allocate time, I think, there's like a lot of sayings where, if you have 5 meetings in a day, if you can cut them down to like emails or you can make things more efficient, I think just the way in healthcare, we're trying to improve workflows. I think even for ourselves is reflecting, okay, can this be just an email? Can this be, or just a weekly call instead of however you do it, I think is important. So I think we're all dabbling with that. And I think to your point, I don't know if there's a magic formula. If you have it, send it my way. If I figure it out, I'll send it your way. But I think to each their own. I think it's something to navigate. And so just kind of building on that piece to more of, back to your business. I know we talked about this earlier where like the insurance space, like you want to work on that and expand that. The end goal is to have a center and have that where people can physically come in. Right now, you are offering those home services, but that end goal is there. So right now, what is, I guess, maybe in the next year or more short term? Because sometimes I think we get so caught up in, okay, this is my end goal. And then we don't take those necessary steps, but you did. You took that short term, like, I'm going to start with home services. And let's go with it. Let's run with it. Let's see what happens. And you're still building off of that. So based on where you are now, what are some of those future goals, maybe in the next 6 months to a year? I know it's years to come is to build that center of yours, and I'm looking forward to seeing that and how that all pans out. But if you could share with the audience of what that plan looks like, even from a digital perspective, if in addition to the platform that you're using, are there other thoughts or are there gaps that you have identified that also like growth as a business and a large scale or on a scale in that sense that these are some gaps I've identified. This is what I want to address. Any thoughts? You can take us in whichever route you want to address that or answer that question, but just your thoughts on that piece.
So starting off with the gaps, I mean, I think the platforms that I have looked at so far are very catered, including the one that I'm using, which is, I think, better than some of the others, but still they're very patient and clinic focused and not as much like for the in-home services type of work, right? So that's like one challenge, and also very patient focused for very traditional medical and healthcare professionals, and not necessarily like holistic or alternative health or like other unregulated professionals like doula services. The needs of a doula and like the things that I would need to document, it's not medication, it's not like vitals, you know what I mean? Like there isn't really. Yeah, I think the tech is like behind in that sense of not fitting the needs of different types of healthcare providers, or what we call a healthcare provider, right? So that's something that I have noticed. And then even in terms of processes, like having things automated, having systems set up for the way that we provide services and the needs that we have in this space is not really widely available or recognized yet, in my opinion. So that's like an area specifically to answer your question on the digital aspect. But in terms of my short-term plans, I mean, our psychotherapy services are brand new. Like we just launched them in December. The sleep consulting services, I'm hoping to launch in the next couple of weeks. So really just getting our services like known and established within the community is a goal for sure, solidifying that and really building on our presence, brand awareness, and becoming like known leader and just like part of this industry and being more established is really my goal for the next year, because we are new and there are several other agencies, but I want us to be known really for the mental health aspect, and our goal being to protect mental health through all of the services that we offer, and that being our passion and, our focus. And just myself personally becoming more of a industry leader and expert. And I'm not saying that, it can be accomplished in a year, but it is something that I'm working towards by doing more speaking. I'm actually on a couple of panels in the next couple of months, and I'm planning to do more speaking as well, not just on podcasts, but, in person and live as well. So I'm currently just finishing up a new parent educator certification. So after I do that, I'm going to be doing more like one-on-one parent coaching and group workshops so that I can also work directly with parents myself through the business and not just working on the business. I want to have some actual interaction with clients, right? So I'm definitely excited about that. So those are just some of my short-term goals. And then long term, I mean, like I would love to be national at some point. I'm not going to put like a timeline on it because it's way too early, but that, I dream pretty big and I have goals, and excited to see where things go.
Yeah, no, I think that's incredible. And there's a lot to unpack there. So I'm going to take my time and go through all that, and I appreciate you sharing that. I think on the digital health perspective, I think that is so valid. I think a lot of the tools are very catered to acute care, primary care, very traditional care, and it's valid and there's a need for it. But I think to your point, there is also other care, like you said, in a more holistic approach. Like you said, some of the tools are not equipped for some of the services you provide for those clinicians that provide them. And so for those that are in the audience listening, there are certain gaps, right? And that's where other entrepreneurs can kind of dabble into and build platforms to account for this, because it is so important. And so I think I appreciate that you sharing that, because I've seen that as well. We've honed in on like the traditional care, and there's a lot in that space. But outside of that, that's where there's a lot of scarcity. And so that's where I think that there's so much opportunity, and through that awareness, like you said, that you're hoping to have more talks, more conversations in person. And I think that's so important. I think awareness is the first step. So whether it's, like you said, do multiple podcasts, multiple panels, you do what you got to do, but to get that word so that people are aware of this. And like I said, I'm guilty of that too. When I first met you, I had to do some research of my own when I first met you, and I was like, okay, this is what it is. And to understand that and have that appreciation for what that means. So I think that on the digital health side, like you said, there is space, there is growth to provide the care that you need, because when there are tools that don't, that's where workarounds come from. So me on the vendor side, I understand that you will come up with workarounds to try to do your best, but that may not be the most efficient way. And that's where duplication of work, that's where burnout can come, right? So it just keeps piling on. So I appreciate you sharing that on the digital health side. Now, in terms of growing, like you said, to have more awareness of those services and where you're honing in on mental health, I think that is so important. I may be biased because right now I work in the mental health, behavioral health space, and I think it's so critical. I'll actually share a story here. So right now, we have a patient portal, a telehealth portal, and so we have, our customer support. So sometimes patients will call and let's say they're not able to log in. And, sometimes we'll have, elderly patients like in their 90s that are trying to seek care. And I think it's just so beautiful to see that maybe in their time, because there's still stigma now. So we can only imagine back then how much stigma there was, that maybe they couldn't seek out the care that they needed. But today, now in their 80s and their 90s, they're calling in so that they can log into their patient portal to access their telehealth and have their virtual care session to get the help that they need. So I think when you say, we're trying to focus on mental health, we have psychotherapy, we have other services that we're trying to build on. I just wanted to kind of, kind of share how that resonates and how I see in my day-to-day how important that is. So I think it's beautiful that you're building on that in a different space, essentially, right? In, particular postnatal, prenatal, but I think it's so important. And so I appreciate you sharing that. And I think about long-term goals where you said you want to be national. Absolutely. I think you got to put in the universe. So like years later, when you listen to this podcast, you're like, I said it and I did it. So I appreciate you sharing that and kind of, allowing the audience to kind of take them along your journey. Like, I'll be kind of cheering you along from the sidelines. I'm sure others will as well. So I appreciate you sharing that and the honesty and transparency with that. So thank you for that. I'm going to kind of close in the podcast now with my last question for you. So being a female entrepreneur, being also on the patient side, where you identified a gap and saw that and how you wanted to address it. If you could share, any words of wisdom that, someone similar, whether they are a patient themselves, that you would want to share to empower them when you were in that position, you didn't know what was happening, but you came out on the other end on that perspective, and being a female entrepreneur, right? How you navigate that. Like being an entrepreneur is challenging as it is. As a female, how does that kind of pan out? So if you could share both sides, because like I said, the focus of this podcast is to empower. So on the patient side, someone that's going in through it now, or someone that has that, if there's some words of wisdom you want to share, and then just being a female entrepreneur, how you navigate that, or any challenges that you want to put out there for other females that are hoping to kind of dabble down that journey. So twofold. I know I keep doing this to you, but there's so much I want to just keep digging at your brain. So I'll leave it to you, however you want to navigate that as we wrap up. So yeah, please take it away.
So in terms of the patient experience, I mean, I didn't go into too much detail about my patient experience, the details of when I was in a psych ward. Like, I don't know how many listeners have been admitted to a psych ward. Hopefully not that many. Like, it's a very, very unique and terrifying experience. And then even being like having a baby, childbirth is also terrifying. So, all the experiences I had having a baby during COVID, like all of these things obviously did not have many positive patient experiences, right? Like there was many moments where I was extremely scared, frustrated, angry. So anyone that, whether it's related to having a baby or not, like anyone that has been a patient in a hospital and has felt frustrated, scared, or angry, allowing yourself to feel that way and making sure that you take the time to process it at some point in your life would be one of my words of wisdom, and not just holding on to that anger. So I definitely held on to some of that for, months after my experiences, and I could have held on to it longer, but going to therapy and taking the time to work through it and accept it was definitely a challenge, but you're only hurting yourself if you hold on to that, right? And like, I'm sure that does not positively impact your health long term, right? I'm not a doctor, but I can imagine that would not be good for your health. So yeah, like just not holding on to those feelings, and recognizing that the system is flawed and has issues, and it's not perfect, and we have free healthcare, so that comes at a cost. Like, this is what it is. Just making the best out of whatever you're dealt, honestly, within the healthcare system. So, trying to take care of you and advocating for yourself, right? Like, that is, of course, a huge lesson, and not expecting others to do that for you. Yeah. Like, just navigating the healthcare system itself is the journey, and definitely a lesson. If you've been through it, then I'm sure of like the importance of advocating for yourself, and the importance of processing all of these things that you might experience. So that would be on the patient side. Remind me what you said.
That's lesson learned for me. Don't throw out all the questions I have to Nancy. No, we're good. No, that's okay. No, I'll share that. Actually, to the patient side, I'll actually share my thoughts as you were going through, because it really resonated with me, and I'll share the last question. But the patient side, I think that's so important, like what you said, where we all go through certain experiences in life, whether, like you said, as a patient, whether it doesn't necessarily have to be prenatal, postnatal, whatever it may have been as a patient, or life in general, to take a moment to reflect and let it go. You are so true in that. Like, I'm guilty of that too, that I will harbor things and just hold on to it. And it makes you bitter. You're like, no, it's making me strong. It doesn't. Just let it go. Take the lesson and be like, all right, bye. It's just
whatever you need. Like, and everyone has a different way of letting things go, right? Like, whether it's journaling, whether it's screaming into a pillow, whether it's
all of those.
Whatever it is. Yeah. Like, you let it go in whatever way it works for you.
Yeah, no, I completely agree. So I think that's important. And I appreciate you sharing that, because I'm guilty of that too, where you'll hold on to things. And sometimes it's, like you said, however you process that, at some point to let it go, to allow yourself to heal. And I think part of your healing process was to bring this to life, right? And so, and every day you're pouring back into yourself in healing, like, this is why I went through it, so I can help somebody else and help myself in the process. So I think that's so beautiful. The other piece that I always say whenever I'm speaking is, sometimes when we're listening to things, we always think of patients as external to us. And I always like to hone in on that we're all patients. It doesn't matter, maybe previously, you may be in the future, maybe someone, a loved one, we're all patients. It doesn't matter your title. It doesn't matter what, profession you're in. So I always like to hone in on that. Sometimes when we listen to things, or we talk about things, or even myself when we're talking, like, okay, the patient this, but I'm like, let me put myself, because I'm also a patient, right? So I think it's important to remember that piece. So I just wanted to share that as you were navigating that we all go through this. And so I wanted to share that piece. So I appreciate you sharing how, letting go, and as patients to allow yourself, and what, advocate. I think that's the second important thing that you said, that they're being cognizant that there can be language barriers. You can be going through a lot. And I've noticed that too, even for myself in the past, whether it's been an injury, having sometimes a family member, a friend with you, because when you're going through it, you do not process everything all the time. So if you are able to, and sometimes we may not have that luxury, so you do the best that you can, but having someone with you, sometimes you are just trying to soak up all that information or absorb it all, that sometimes having a loved one with you, or a friend or somebody with you, helps ask those questions that you may not process. So I think that's important as well. So I appreciate you sharing that. And I know we didn't dabble too much into your patient journey, but I appreciate the pieces you did share with the audience. The last question, I promise, and I'll ask it in a single shot, is, in terms of being an entrepreneur, but a female entrepreneur, how do you navigate that, right? So there are so many moving pieces there. Being a female, being an entrepreneur, being a mom as well. I know you share that guilt, but how you share that earlier, where you have that guilt, being a mama bear, and wanting to, if just for the audience, just as you navigate your journey as an entrepreneur, as a female entrepreneur, were there some specific, challenges that you felt as a female, or that you wish you had done differently? Or actually, you know what? It doesn't matter. Entrepreneur, right? Everyone's take on this is different. So I just wanted to hone in on your perspective of that, for those that are female in the audience that are thinking of going on to their entrepreneurial journey. If you could share any wisdom, you can take this question however you want to take us through, but just for those in the audience that are trying to experience that, if you could share that with us. Yeah.
So I'd say one of the biggest challenges is, and I don't want to get too much into the feminism conversations to mess, like, the what is the traditional household and all of these things, but I will say, typically, like, being a female entrepreneur, one of the challenges is you still have to do all the other things that you would do as a woman and as a mom. traditionally. So, it takes like so much time and energy and focus to build a business, but everything else is still your responsibility. So that in itself is a huge challenge. I'm still the one like waking up and taking care of my kids. I mean, okay, I have to give credit to my husband. He's very, very and I don't like to use the word helpful actually, and I just used it. I don't he equally contributes in our house. So it's wonderful, and I'm very fortunate to have him. But like still, like in terms of I know this is talked about a lot, like the mental load of being like a mother is massive. So all those things are still my responsibility, regardless of the fact that I'm an entrepreneur. You know what I mean? So I still have to manage the appointments and this like their needs and the shopping list and the groceries and the whatever else and the school communication and blah 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 blah. Like all those things are still on my plate, regardless of the fact that my business needs so much time because it's new and like all of the stuff, right? And it would be wonderful if I could just work 24/7 on it and not have other things to do, but that's not the case, right? Like I still have much more responsibility. So that in itself is a challenge. But aside from that, I mean, I've never really, and I guess I'm fortunate in that sense, like going through my academic, career, my academics and then my career, like as an accountant, I've never really considered myself to be at a disadvantage being a woman. Like I feel like I've been fortunate enough to whatever progress as I wanted to. So I've never thought about it too much. And then obviously now in the space that I'm in, it's very female like oriented. And so it's not even a challenge. It's not like I, had barriers entering this industry. It actually helps a lot that I'm a mom. Yeah. Yep. But no, it's not a challenge in that sense. And the opposite is true in that I have found so many other women entrepreneurs and mom entrepreneurs that have supported me in the past year, and it's been amazing. So I think that is like a bonus to have that aspect of like community and support to help other entrepreneurs that also happen to be female. So it's really wonderful, and I haven't had too many issues or challenges beyond like having additional responsibility.
No, and I appreciate you sharing that. And I think that's so true. Like I've heard this, like you said, where being a female with doing whatever you're achieving, all the accolades, running, a business, you still have to do the other pieces as well. You cannot fall short on that. So I think that is so valid. And I love the fact where you said, like on the other side, where you're navigating the space where, having other female entrepreneurs or mom entrepreneurs also support you. And I think sometimes we forget that sometimes just asking or just taking a step forward in that space, you will kind of attract, individuals that are willing to help or in this space. And sometimes it's just taking that step. And then the other piece where you said, whether it's in your background as a chartered accountant, you haven't seen that where being a female is, maybe, as a disadvantage. And I think sometimes it's important. I remember hearing this, it was on another podcast actually. And the guest had said where she's like, even if you sense that, being a female can be a disadvantage, just see it what it is, accept it for what it is, but keep moving forward. Don't use it like you said, just you're a chartered accountant, you have your designations, you have all of that, you just keep navigating the space. You acknowledge that there may be some, barriers or anything of that sort, but you keep moving forward. I think even though when they say like she's, a girl boss or, just I'm a boss. Have it on the back of my wall too, like a boss. Like there's no she, like female, nothing. It's just, and so I think that's also owning that, like owning you before they do. So I think you sharing that and I think appreciate it. Not to discount that there are barriers that there can be, but I think for ourselves mentally, your mindset, like you said, is just own it. This is what I am. This is what I'm going to bring. I'm just going to navigate it as an individual, not the fact that my gender or anything that should. It does on a societal level, but for yourself, your mindset, I think it's very important. So I'll kind of wrap it in there. So thank you so much, Nancy, for taking the time to speak with me today. I hope all of you enjoy this. I learned a lot. I know I bombarded her with a lot of questions, but I was just trying to pick her brain. There was so much good stuff that I just wanted to get out of Nancy. So I hope you enjoyed this session and kind of, enjoyed our conversation, our journey as Nancy took us through her story. I hope you learned a lot and stay tuned for another episode of Empower Speaks Healthcare Talks, and we'll see you then. Thanks again, Nancy. A pleasure having you.
Thanks so much for having me. This was awesome. Thank you.
No problem.